Welcome everyone to the training webinar series, Eyefinity Encompass Essentials, Troubleshooting Made Simple presentation. Thank you for joining us today. We look forward to your questions throughout the presentation. You can enter them by clicking on the Q&A icon on the top of your screen. My name is Linda Park, and it is my pleasure today to introduce Jonathan Barfield. Jonathan has over 16 years of education and 11 years in healthcare IT experience. He's an educator at Eyefinity and also trains at our on-sites and hands-on sessions. He's a United States Air Force veteran and an alumni at the University of Georgia. Welcome, Jonathan.
Hello, everyone. I hope everyone is doing great. We're happy you're here to learn more about your EHR. I recognize a lot of names in here. It's nice to see. I've been here for quite a while now. I've trained a lot of you doctors, so it's good to see familiar names. Let's go ahead and jump right in. Okay, so what are we here for today? Essential tricks. Essentially what we did is we looked at what are very common things that people call our help desk for. And you might be surprised that the top, bunch of the top ones are all kind of centered around the same kind of thing. Resetting passwords, adding users, adding doctor roles, unlocking people, all having to do with adding or managing users in the system. So how about today? We would go into a deep dive. Let's go over how to add users. Well, we'll go over all the different roles, how to add the doctor role, and then how to reset all passwords, how to set employees' passwords. What happens if you forget your administration password? Oh no, what do we do? Well, we're going to go over all of that information. So I am in my firm admin. So if you do not have your firm admin password, problem number one, we'll get to how to get that reset here in a little bit. But hopefully you still have your administration password. I'm going to go over in a little bit. You might end up creating after this call another administration, one specific to you, but we'll talk about that here in a little bit. So just creating non-doctors, that can be front desk, that can be ophthalmic techs, whatever you like, kind of all the same. So I am going to go ahead and hit create account. So here's all my users in here. We're in my training environment. I have a lot of users in here. You probably don't have this many. So I'm going to go ahead and hit create account. Okay, so very simple for your normal everyday user. So you're going to put a last name and a first name. So EHR. I'm just going to be I'm not going to end up saving this. We don't want to create more and more users. You can enter a birth date now, okay? But the user, when they first log in, and you probably, if you haven't logged in a while, being a first-time user, when you first log in, it's going to make you enter a birth date and a email. That is very important because when we get to resetting passwords, you can reset your own password if you have your birth date and a correct email in there. Okay, so username, this is up to you. A lot of people use, first initial, last name. This can be whatever you like. Password, I'm going to enter a very generic password, password 1 with a capital P. With a capital P, you're going to verify it. And then I'm going to check this right here because when they log in, I want to force them to enter their password. And you can change the password requirements. I'll show you where that's at. Pretty straightforward. You can set a number of different ways to have length and complexity of passwords in there. All right. Roles. So lots and lots of roles in here. Okay. Many of these roles do the same thing. Okay. You might also notice that there is no doctor role in here. You can't add doctors. We'll cover that in the second part of this. Most of these roles cover the same thing. Just to show you a detailed example or breakdown of what each of these roles can do, I'm going to go to the help menu because part of this session is to help you help yourself. I think our help menu is a lot of times people are calling our help desk for resetting passwords, creating users. I want to demonstrate also in here how helpful our help menu is. A lot of times you can just go to the help menu and get your answer right away rather than calling support. So just to show you how easy it is to even find out what roles there are, I'm up in the top right-hand corner. I'm going to click help and I can type roles up here, but I'm going to show you how to get to the whole section on adding users. I'm going to go to get started on the left-hand side. And now I'm going to go to managing users. And the first little link it has is understanding user roles. So if you've never seen a breakdown, okay, so there's different tiers. You have tier 1, tier 2, tier 3, and then this is your administrator role. Okay. And you can set up junior administrators. We won't go into that today. Essentially, you can have multiple administrators and limit them to certain areas, like creating, consents and waivers. All right. So you can see that these two sections, these are what you're going to use for everybody that's a non-doctor, okay? They really have access to all the same stuff, but if you add these roles right here, you can give them access to overriding billing, okay? You won't be using the direct mail, all right? But you can give them access to overriding billing. That's really the only thing. So really, they're all doing the same thing. So what's the benefit of giving people different roles? There are areas inside of firm admin. We won't get in them today, but you can limit when people can log in. You can set user roles and things like that, where you can restrict when people can log in. And those are specific to different roles. So if I only want my front desk to be able to log in to my cloud-based EHR during office hours, I can set those hours and assign it to that role. Okay. Whereas if I give everybody off-malt tech or certified off-malt tech, I can't limit certain groups. Okay. And just to let you know, further down this year, I believe in Q3, we do have a firm admin where we're going to dig a little bit deeper into firm admin, where we will touch on these extra functions. All right, so these are all our roles. So like I said, very easy to find this in the help menu. All right, so once I give a role, and I'll just give this one certified off, this is where you can give billing privileges. Your techs won't be e-prescribing, but you can give them billing privileges to override billing codes and all that. And after that, that's pretty much it. Email along with the birth date, you can either enter it here for the employee, or they're going to be forced to enter it, and that's to reset passwords. All right. So I'm not going to go ahead and save this right now because I don't want to create more. But once you have it created, you have a couple other options on the left-hand side over here. Okay. So really, you won't be using these for non-doctors. But if I go to settings, you can set their primary facility that they're at. They can also set this in their preferences, but this will be their general if they do not set that. So if you have one facility, you really don't have to worry about that. Okay. The one thing I do want to show in here is allow patients to send intramail. Okay, don't worry about schedules. They won't have any. But this right here, I always tell people you do not want to check this to receive it. If you're using the portal or any messaging systems where patients, you don't want to check this. You want to set up staff groups. You want a front desk group, a tech group, a doctor group. You only want people to send information, a patient to send questions and information to a group. You don't want them to be able to send to any one individual, because what if that person is not there? What if they're on vacation? If it goes to a group, a whole bunch of people can potentially answer that rather than a singular person. All right. Perfect. All right. So let's cancel out all that. So doctors. Okay. So To add a doctor, okay, there's two ways to kind of add it. You can call support or you can go to our community. The information that you will need to gather, okay, for doctors, because doctor accounts incur a cost to the practice, Eyefinity manages those accounts. So we manage those, we add them. The information you'll need to gather: the practice owner's individual email address, the doctor's first name, last name, and NPI, the doctor's employment status, full-time, part-time, the doctor's scope of practice, optometry or ophthalmology, and the doctor's familiarity with Encompass. Essentially, do they need training? All right, so you're either going to call support, or I have our support community right up here. Hopefully you still have this link and you have the login to it. If not, call support and they can provide you with that. But you don't need to click on any of these. Really, you can go down to add provider or location. And that's going to bring you here. I'm going to hit add provider and select. And then I'm going to fill out these three fields. All right. Once you fill out these three fields, you will receive a DocuSign form, and you're going to fill out that form and you're going to submit that back. And then Eyefinity will create and add in your new doctor. Right. Once again, if you don't have access to the Eyefinity community, please call our support. And as I say, keep saying, a lot of people don't know the number to support. It's been a while. Whenever you're logged into EHR, scroll all the way down to the bottom and you can see customer care is right here. Whether you're logged into firm admin or your everyday login, it's always at the bottom. That's who you can call. So, unlocking accounts or resetting passwords, okay? So let's start with, if a user forgets their password and after they try it 5 times, it's going to lock their accounts, okay? You can see over here, all of these are unlocked. So whoever the administrator is will need to come in and find the employee who has the lock. I just found all of our unlocked. And really, very simply, you're going to click unlock, and that unlocks that user's account. If they also forgot their password, okay, you would go find that patient, okay, and I can click on any of these, all right, and then you can come in here and reset the password right here, okay. So the second part of this, you can unlock the account. Now we're into resetting passwords. The first option, if they haven't locked their account, okay, is for them to reset it themselves, okay? When you go to log in into the EHR, there is a forgot password link like you see on any login. They can click that. It's going to ask for their last name, their date of birth, and their email. That's the importance of them entering that either when they log in or when you're creating an account. If they have that information in there, it will send them an email with instructions to reset their own password. If they are unable to do that, or this is actually a lot quicker than waiting on the email. It's actually pretty quick. But if you don't really have time and you're there, you're the administrator, you can quickly log in. I'm going to come in here. I'm going to enter a password, confirm it. I'm going to check this box. I'm going to hit save. And that's it. Just make sure they know their username and they should be good to go. As soon as they log in, it's going to make them reset their password. All right. So that's how we reset passwords. They can reset it on their own if they enter their date of birth and email, and or you can reset it here. The second part of this is disabling user accounts, okay? You cannot delete user accounts. If someone leaves, you can really only disable it. You can see this one actually is disabled, okay? So if you have anybody leave, come in, click this disabled, click save, and even if that account is unlocked, that account's disabled, they won't be able to log in from that point going forward. All right. If that person comes back, I'm going to go ahead and uncheck this, probably reset their password. They've probably forgotten it, and they'll be able to once again log in. All right. So your admin password. So how to reset this. Okay. So first thing I want to talk about is if you still have just the original firm admin, okay, hopefully you have changed the password from the defaulted change me with a capital C and a 1 after it. So this is what you're provided at the beginning. This is how you're first setting it up. You can create other administrative passwords. So let's say the doctor, okay, so I'm a doctor in here, Dr. Barfield, I'm not a doctor in real life, okay. If this is my account to log in to the medical record side to do all my daily work. If I wanted to also have administrative rights, okay, on top of this one, okay, all right, I can come in here. I'm going to fill out this information. I'm going to add a username. Okay. It's slightly different than my original. And what I'm going to do is I'm going to give myself the administrator role. If a user has this role, when they go to log in, it goes immediately to firm admin. Okay. So you might have a doctor in the office that originally set it all up with the firm admin, all that. Maybe you hire a GM and you want to give them access also instead of giving them the same firm admin and password. You can create their own or everybody that needs it. And you can just leave the firm admin with a defaulted password to something that you can use in an emergency if everybody, loses their password. You would also, and you might not have done this yet, when you first log into the firm admin in your live environment, it also asks for your date of birth and an email. So really, because this is the general, you can make up a date of birth. Okay, maybe you make it yours and then add an email to your firm admin because you can still use that forgot account if you have a general practice date of birth and a general practice email. I can utilize that for my firm admin. Any other users that I set up with the administration, I'm also going to make sure I have the date of birth and email attached to that. That way I can reset using that. Okay. So the ways to reset your admin, okay, is to use that. There's 3 ways. You can use the forgot password link, okay. The forgot password is going to ask for last name, date of birth, and email, and it's going to help you unlock by sending you an email. The second way is to ask another admin user. Like I said, if you have multiple admin users, I forgot my personal one, but I still have my firm admin that I know. Or I'm the doctor, I forgot my administration, but my manager also has their own. They can come in here, click on your name, put the password in, and save that. Okay. The third way, maybe all you have, you're sitting on here and you're like, I went live 3 years ago. I haven't logged into firm admin. I can't remember anything about that. You can call our support. For a lot of offices, they haven't logged in the firm admin in a long time. We're adding lots of new functionality. Maybe, hey, let's just start using the kiosk. Let's set up consents. How do we do that? Call our support and you will be able to get that unlocked. All right. If you do call our support, they're going to have you fill out a form authorizing Eyefinity to reset that password, just so you know. All right. So that's all about users. That's all about, remember our help menu. You saw all the different help options in there. Lots of great information, videos, step-by-steps to go through all of the things we cover in here. Sometimes people call our service desk and wait for an answer, but you can really, a lot of times, just go to our help menu and get that answered right away. All right. So the second part of this, okay, if you've been live for more than 6 months, I'll say, it might be less than that. When you went through training with myself or any of the other trainers, we went through a whole spiel about at the end of the visit and finalizing your exams. Okay. Don't finalize until you're sure. You can finalize in bulk. Once you finalize, you cannot unfinalize. You can only do an addendum. So if you want to go back and add findings later on at your desk for that OCT, fundus photos, you don't have time in front of the patient, don't finalize your visit. You can come back later and then finalize later on. Now, that's all changed a little bit. You might have heard about this, but maybe you didn't really realize how it's done or don't know how it's set up. You can now unfinalize your exams. Okay. So if you didn't know this, you're about to get very, very happy. So how do you first have to set up in your firm admin. Okay, so this is a setting. The setting recently just changed. It used to be just a toggle switch where you turn it on and any provider that finalized it can utilize it. Now it's individual logins, but still only the provider that finalized can unfinalize. So you're going to scroll down to this little area right here in your firm admin. And we have this right here, managed finalized visits. And this is very easy to set up. Okay. You're going to find the user and you're either going to click enable if they are not already enabled, or you're going to click disabled if you don't want them to have. So it might be, you might have new providers where you don't want them unfinalizing for whatever reason. The other way, if you did set this up previously, it was a toggle switch. You just turned it on and everybody could use it. Now we've limited it because there might be situations where you don't want doctors unfinalizing. So once they are enabled, you can finalize. All right. You can also do it in bulk. You can go down. Notice it has all of my employees in here. If I allow this for a tech or a receptionist, all that, obviously they're not finalizing visits, so they're not going to be able to use it. So, just do the doctors. How do I unfinalize once it's set up? I'm glad you asked. And you can also do this on the iPad. I will not be sharing my iPad today, just for timing's sake. I'm going to go into a patient. And you can see I have some finalized visits over here. Okay, so amongst your copy forward and hide, I have edit final visit. Okay, so if I want to edit this final visit, I'm going to click it. All right, it's going to give me this pop-up. All right, so there's a little bit of a processing time. See where it says preparing for edits. When you finalize, there's a little time period. I'm not sure what's going on in the background tech-wise to lock those down to where you can't unlocking. So there's a little bit of prep time for unlocking. So maybe if I'm busy, I click that, I can go take care of some other stuff. Hopefully it usually is only 30 seconds or something like that. But there is a little bit of prep time to go through that. All right, so let me give it a second. If you come back to the visit, all right, so you can see it's correcting. Okay, now it's done. So it's just an open visit now. Okay, so I can come in here, maybe, I don't have my disc ratios. What a great example. I'm going to click here and I'm going to add my disc ratios. And I'm doing this from the simple exam. If you haven't seen the simple exam, I'm going to go into a little bit more detail in our next little section. You need to be using this. Okay, so I just added my disc ratios, and maybe I did a screening this day, but I also forgot it. So I'm going to click special plans. I'm going to come down to screening testing, and I'm going to do screening retinal photos, save it, did it in each eye, and save. And now it's got my screening photos over here. All right. Very important. I cannot resend fees for this. So if it's something where you're generating more fees, and obviously you're unfiling, so this patient's probably gone, they've probably been checked out. So you're just adding information. If you're changing billing codes and things like that, you will have to, go up front and let them know. Okay. Right. Once it is finalized, the next time you come in, you still have a record of the old one. Okay, so when you come in to that visit, and just so everybody has a visual, I'm going to come back to this. I'm going to click on it. It goes to the final, but notice I can switch back to the original. Okay, so you're always going to have access to what was originally done. There is a record of it. And the same thing can happen on the iPad. Okay, so the last thing I'm going to be covering, all right, and this should be very exciting for some of you users, is how to auto-generate a diagnosis and associate diagnosis for our refractive errors. So for offices coming from ExamWriter, this has been asked for a very, very, very long time because our ExamWriter users were used to entering that refraction and it automatically throwing in that diagnosis. It also does that in this system now. Right? So how does that work? So I'm going to come into this visit that I very conveniently have here that's pretty much set up. So I'm going to take this time to also do a visit from our single screen view. Okay, we really want users to transition away from going into the vision exam, going into the ocular exam. You really can do everything you could possibly need to do in a visit right from this screen. Okay. If you're asking, hey, I use the iPad, same thing. In the top right, you can switch to our single screen view away from that tile view, and everything I'm about to do, you can do on the iPad. So my tech has already entered my chief complaint. If I'm talking to the patient and as the doctor, I find they need another chief complaint, I don't have to go click over here. I can click right here and I can add it really quickly. Maybe they also have a little bit of, let's say red eye. Maybe it's in both eyes. I'm going to hit provide details and I'll say it's new. I'm going to be very quick here, just on for time. And notice it just goes right back here. Okay. Our vision exam. So my tech has already entered a wearing. There's an auto refraction and an IOP. Okay. Instead of going into the vision exam, okay, notice right here, I'm going to really quickly do mark pupils motility visual fields. All right. I'm going to click here and I'm going to go to my refraction. And instead of going in there, I'm just going to do it from this pop-up. Okay. I'm going to click on refraction history. Ooh, I got to enter my refraction type. And I'm going to pull forward my auto. And then notice once you enter manifest right here, you have to have manifest in this box. If I remove manifest, this won't be here. But notice right here, I have diagnosis, counseling, and follow-up. Notice this little green S right here. This sticks, but there is a little caveat to this that you might not like that I hope is fixed in the future. But I'll cover that after the fact. So I'm going to check these boxes. I can make changes right here. Maybe, after my expert corrections, they are now 2020. I'm going to go ahead and hit save. And the only other thing I would need to turn this green is really my visual acuities. All right, so I'm going to go click visual acuity and I'm going to add a corrected in 2020. So I can do everything from right here. This is convenient, okay? So notice on my refraction, okay, I can even finalize right from here. Maybe I don't like to finalize until I've done my slit lamp and observe the fundus. Here's the beauty of getting proficient in this view. If I don't like scrolling, if I need this to go away for a little bit, I'm going to close this up. Notice over here, I can create new, edit. I can, do anything I need right here. All right. So now I'm going to come down to my exam portion. So if you're using the ocular exam, you're clicking on perform exam, you're clicking on your type of exam, and, really you're used to this right here. This is what you're used to, okay, if you're not using this view. I'm going to reset this and I'm going to get rid of it. And instead of using that, I'm going to click on this little simple eye exam right here. And this will really quickly allow me to add in my disc ratios. I can turn on or off my dilation, my disc, my fundus. I can add any type of finding that you can add in that other right here. I can select it and I can copy it over just like that. I can add any finding that you add in the other. All right, I'm going to go ahead and done with that. And it marks everything just as it should. So now I want to go finalize my refraction. So I'm going to come up here. I'm going to open this up. I'm going to say, yep, let's go ahead and finalizing. This is because I pulled it forward. So I'm going to say this is your full-time wear. I'm going to go ahead and save that. I can even send it from right here, or I'll be able to come up here and send it. If I want to create another, I can click this and do it. If I'm doing my exam, here's, where this gets even better is, in fact, I'm doing my, in conversation, the patient say, hey, I've been thinking about contacts. I don't have to go all the way up, click in my vision exam scroll. I'm just going to say, okay, I'll give you a couple trials. Here you go. Click on my soft contacts, add it in there, So a lot of, proficient ways to use this over the old view. All right. So now that I scroll down, take a look what's already here. I didn't add a protocol. Look at this. It's got myopia. It's got my associated diagnosis all right here, all from entering it in that refraction. Okay. So it's got my follow-up. So it uses the sticky field. It's already got my 12 months. It's got my refraction. It's got my counseling. All right. If I did contacts, I'm really just hitting add plans. And I'm going to add my contact lens assessment. And then maybe I'm updating the level of billing. All right. So couple caveats to this. Okay. If you have refractive errors set up in protocols, you're going to use one or the other. You wouldn't use both. Okay. So if you were to use this with protocols, it's going to double document. Okay. So if you don't have protocols, this is a big help. If you're new to the system, this will be a big help. Maybe you like how this works better than your protocols. You can use this. And then maybe for all my medical things, I'm using protocols. All right. The one thing I want to point out about this that is kind of, it's not my favorite. So when I hit create new, all right, and I click manifest, notice these are checked. Okay. But if I go to refraction history and I import in something, notice it unchecks those. So I agree. That's a little, so if you are used to using refraction history and pulling those in, you got to check these every time. And it's my hope that this changes in the future. And if I have these defaulted, whether I pull something in, these will stay right now. So if you have these checked, you would manually enter them, or you can just import it in and check these boxes. And this will allow you to utilize that function again. And that's it. Okay. Let me go ahead and get my PowerPoint back up. And does anybody have any questions?
Thank you, Jonathan. It does not look like we have any questions. Just a reminder for everybody on the line that you can enter your questions using the Q&A icon on the top of your screen. We'll give it a few more seconds to see if any questions roll in. Oh, it looks like we have one. Are there any best practices when for phasing out a doctor to ensure refill requests, etc., are forwarded to another doctor or role? Disable is through the help desk, correct?
Yes. Oh, yes. So you can disable a doctor role on your own without calling the help desk. As far as refills, who can we jot down that doctor's name? And can I follow up with that doctor? I was not expecting that, and I need to look into that as far as refills, how that would be worked, but I can follow up on that with you.
Okay, perfect. Yes, so we will email that response out.
That's a great question. Very good.
Okay, well, with that, doesn't look like we have any more questions. Oh, wait, let me see. Sorry, we did get one more pop in. It was in response to the last question. It said, auto refractor input for manifest. Would it also unchecked by default, like importing?
I'm not sure I follow that. So if you import the refraction, so you're asking if you import in the last refractive error? When you import in, it is going to uncheck. It doesn't really have to do with what you're importing. But if you're use the refraction history to import, right now it does uncheck, unfortunately.
Okay, got it.
I
And
think that answers your question.
then one more asked, how can we find our account number?
I'm not sure what we're talking about as account number. Can we be a little bit more specific on that? Are you talking about your account to log into the community?
I am guessing they are asking for their Eyefinity account number.
Hmm. That would be a call to support. If you don't know support's number, like I said, scroll down on the EHR, and it's 1-800-942-5353. Okay. And they'll be able, I'm not sure what account number you're really speaking towards, but if it's an unknown account number, obviously I can't give that out over here. You would need to call support regardless. And I'm pretty sure the answer to your question is to call support for that.
Okay, perfect. And then I think that's all the time we have for questions today. Um, so with that, I would like to let you know if you're looking for more training, you can check out our other learning options such as documentation, tutorials, and walkthroughs, role-based training, additional training webinars, one-on-one virtual training, and on-site training or consultations. You can learn more at eyefinity.com/education. Jonathan, if you just advance the slide, we can show them the link for the other education resources. There we go. So once again, you can learn more at eyefinity.com/education. And right now, I would like to thank you, Jonathan, for your time and for all of the valuable information you shared with us today. And thank you all on the line for taking time out of your busy schedule to join us. This concludes our presentation.